they take hormones as young as they can because they don't want to lose their hair. They don't want to gain weight. They don't want to not have a sex drive. They don't want to lose their memory. It gives women higher levels of estrogen and men lower levels, and it gives us lower testosterone and them higher testosterone. So in general,
today we have a very special guest, Dr. Gowri Reddy Rocco. She is a double board certified functional medicine and in regenerative anti-aging and functional medicine, and is known by her patients as the wellness warrior. She's been practicing medicine for over 20 years and is the founder and president of Optimum Wellness and Longevity. She is also the author of the book Grow Younger. Dr. Rocco, welcome to the Functional Nurse Practitioner podcast.
Thank you for having me, Tara. It's a pleasure to be here.
Well, we are thrilled to have you here. And as the listeners know, I always love to know whenever I bring anybody new into their world, if they don't already know you, what is your story? The why behind your journey in particular into functional medicine?
Okay, so I have a very personal story. When I am from India, so my family came here when we were very young, about 6 or 7 years old. And so I've always had that Eastern culture in me, like integrative medicine, Ayurvedic medicine, that I just always have it as part of my genetics. So when I trained to do medicine in the States, it was a little disappointing because I'm learning about how to use a prescription to heal everyone. And that's not what I thought medicine was. And my dad was probably my favorite person, role model in medicine. And he always practiced with his heart and used his brain to help heal people. He's a psychiatrist. So when I went into medicine, I thought, oh, I'm going to be able to teach people lifestyle and teach people how to eat better and do the right actions to improve their disease so they can reverse it. Well, quite the contrary. When we go to med school, we're taught how to give a prescription, how to give a diagnosis. And the cure is usually the drug. And that's usually not how I like to work with my people. I want my people to have options. Like you could take a prescription and you could also graduate from it. And this is how we do it, right? So we stabilize people, we teach them better improvement and functionally fix what's wrong. So it's the sad thing is I have a sister and a brother, and my sister, she's the youngest one. When she was about 18, 19, she got hit with a really horrible issue. It's called schizophrenia, bipolar affective disorder. And it's not back then, like about 20 years ago, there wasn't a lot we could do 24 years ago, actually, when we were growing up. And it really debilitated her functioning. And she relied on prescriptions to function properly. And I couldn't believe that there was nothing more we could do. And she lived with it for a long time, Tara, but 9 years, but not ideally.
Wow.
Like she was hearing voices, she was going to college still, and then she became so debilitated that it affected her quality of life. And all we could offer her was medications, right? So when 9/11 happened and she thought the end of the world was happening, she pretty much ended her own life, in a very peaceful way. She turned on the car engine and in the garage and wrote a beautiful note to us. It wasn't out of anger or hate. It was just out of fear that the world was ending. Mm-hmm. And it was then I realized that, why am I a doctor? I thought I was going to be a doctor to help people like my sister. And all I could give her was prescriptions. So it really was a life-altering era in my time, because it helped me reevaluate how I wanted to help people and have the courage to step out of the box and mm-hmm. go elsewhere, really explore my academics in a new way, start all over with wellness as far as regenerative, functional, preventative medicine, metabolic medicine, cellular medicine. So that's what I've been doing now for 25 years. And I do it in honor of my sister, because I want to really impact people. If they don't take the prescription, they can still be okay. Do you know what I mean? So it's really, it's a blessing, because she lives with me every day, and she's my angel. She helps me have patience to help other people when I'm just so confused and lost and I need to learn more, So that's my story. And I love what I do. I genuinely love what I do.
Well, your story really, really resonates with me, and how difficult that must have been for you and your family, but also beautiful
Yeah.
for like the closeness that you still have with your sister and
Yeah.
the impact of for you
Yeah.
and as a driver. So that's I
Thank
don't
you.
I don't get speechless very often, but that it really really like speaks to my soul. And I find those of us that travel down the alternative highway, especially in functional medicine, it is for a very personal reason.
Yes. Yes. We all have those painful, as I'm sure you do too, because you're very driven in this field. Yeah, we've all been impacted, like not just our hearts, but spiritually. It keeps us. It gives us the energy because there's a lot of work studying and reading and keeping on top of this. Functional medicine is not like common. So I mean, it
No,
is. We know about it, but getting academia on that is not common. So I know I give you a lot of credit for having this podcast, for educating all the people that want to learn about it, because I feel like there's not enough of that going around.
there's not. And something else that you said really really like hits me like in a like a special a special way, for lack of a better word I can find at the moment. It's that the mentality that we get the diagnosis, like, I was conventionally trained as a nurse practitioner to figure out what's going on, diagnose, and give a prescription. And that's when you said that, not like partnering with your patients or anyone that you're working with, that we have other options,
Yeah.
and putting them in the driver's seat, or like I tell my patients, the captain's chair,
Yep.
where, and I'm not against that road, but that road oftentimes leads to more problems, and it doesn't solve anything. So so many things about you, because of course I looked you up and see that we're pretty connected on a lot of different things aside from functional medicine, and in particular women's health, which
Yes. Hmm.
I'm very passionate about as well. And
Good.
and and some things I've read about you with regards to like supplements and protocols related to supplements and blind supplementation, and because, and I'm not going to spoil the surprise because I have a list of questions.
Right. Right. Uh-huh.
So how about we start, because I know the listener is very interested in one particular topic.
Uh-huh.
It's a big one, hormones. and
Yes. Yes.
and
Hmm.
I read something that you have this idea, this notion in your practicing, where nutrition can play a big role with balancing hormones. And I would love for you to speak about that.
Yes, absolutely. I'm so glad you asked me that question, because not everyone, Tara, not everyone has to take hormones like supplementation, Tara. Like they don't have to take like a prescription, or like a conventional big pharma, I should say, prescription for hormones, or you don't have to take a bioidentical, which is like plant based, right? Like there, you should start off. Actually, I encourage people to start off doing nutritional. So,
Mhm.
because if that works, you're good. So when we start going through menopause and it starts happening, like I'll just call it women's changes, because it sounds like such a bad term, and I just don't like it. I'm
Mhm.
sure it was created by man too, that term. So
Yes,
because
I'm
it's
sure.
men pause, which doesn't make sense. It should be woman pause. So the way I see it, like it's about 37, we start losing our ideal estrogen levels. We start declining. So I tell people, if you start walking and start just movement is so important. If we start walking at a young age, then you keep your hormones longer. You keep producing estrogen and progesterone and testosterone, and you crush cortisol, which is the one hormone that we make as we age, which is the evil hormone that makes us gain weight and get depressed. So exercise, but with nutrition, the things that we're not told is that phytoestrogens mean plant-based estrogens. They're everywhere. Lentils, legumes, eating quinoa, yams, organic yams. I am big on non-GMO foods. So when I
Mhm.
talk generally, I want people to know I'm talking about non-GMO, organic, plant-based, whole foods. And even if you eat meat, that's fine with me as long as it's pasture-raised, organic. Okay. So when you eat a lot of phytoestrogens, which in Europe it's very common. They take hormones as young as they can because they don't want to lose their hair, they don't want to gain weight, they don't want to not have a sex drive, they don't want to lose their memory. So all these things happen when we lose estrogen and we go through that change in our life. So the exciting thing is, okay, so we're 40, 50, the average age of, going through this is about 45. So that's just half of our life. So we can't live the other half without having all these great
Yes.
hormones, right? So the way you get them is please eat more lentils, eat more wild caught fish, get vitamin D in, because vitamin D, like from the sunshine, you don't have to take the, even if you want to just be all nutrition based, go outside, sit in the sun for a good 30 minutes, 40 minutes, 60 minutes. Don't wear sunscreen on your face and just go for a great walk every day. Go hiking, go swimming, sweat in the sun. And so then you absorb vitamin D, and vitamin D is a hormone, and you need that to produce your own estrogen, progesterone, testosterone. So, but critically, eating phytoestrogens, which means like lentils, legumes, and yams, it produces your own hormones. And another one I need to express is edamame or soy. Soy should be organic because about 92% of it is
Mhm.
GMO produced. So we want to eat organic soy, organic tofu. And so all those produce our own female hormones.
You are speaking, yes, yes, yes. You are speaking my language. I am
Awesome.
definitely a food first practitioner and
Awesome.
and
Good.
nerd out on this sort of thing and mentioning like lentils and how vitally important they are, and that
Yes.
if we start if we really focus on whole foods early, instead
Yeah.
of like we get an issue, we got a problem, now we have a disease of some kind or something's going awry. And then, I mean, if we haven't done it up until that point, absolutely any time is a great time to start. But why wait? Right?
Exactly. I know. Why wait? I mean, prevent it or just like go. I call it cruise control. Like go from one shift to the next. Like, why do you gotta like have some devastating effect? Your medical life should be boring. Like it should be really uneventful. But people
Yes.
wait for that drama and trauma to shift them into good behavior. You know what I mean? So I'm with you
Yes.
on that. Like I totally think you should start early and it should be implemented. But you somehow someone impacted you to feel that way, but many people aren't impacted by that until they go through some disease formation.
Well, yeah, and for me, it was getting all
Oh,
these autoimmune diseases, and I wanted the magic answer. That's why I went to IFM, Institute of Functional
right,
Medicine, was because I was looking to survive. Because I
right,
actually thought I had cancer, but I didn't. I found autoimmunity, but I was looking for the magic pill. So I did everything backwards. So I'm on a mission to spread the
yeah,
word. It we don't have to we don't have to have such like struggles. It doesn't have to be so complicated. And feeling better doesn't have to take years, but it's going to take a shift here
yes, yes, Jen.
more
Yep.
more than
Hmm.
more
Mental
than
shift.
anything
Yep.
else. And
Hmm.
and you brought up one of my favorite things to talk about, cortisol. And
Yes.
and it's so I feel like it's that also is really misunderstood. And it is, it's the fat storing hormone, but we would die without
Oh
it.
my
Like
gosh,
like
absolutely. Yes.
like we
Yes.
we need it, but
Yes.
as we age, and I feel like this is happening even younger because adrenal dysregulation is very common because we're in an ultra stressed out
I
society,
know. Yeah.
and
Yeah.
but we're always looking to suppress like I these adrenal cocktails that somebody was telling me about this the other day. And I try to maintain composure because it sounds like I'm against these things, but if we're doing that and not walking like you mentioned.
Exactly, exactly. We don't just like, there's no easy flip, even in functional medicine. No, it's not like that. So I totally agree with you. We need cortisol. It keeps us excited. It keeps us like gunning, like go for it. Like, life is not easy. And it's cortisol keeps us like motivated and ambitious. And cortisol isn't bad. It's how do you cope with stress, right? Like, what is our go-to method? Is it alcohol? Is it eating? Is it sugar? Like, right? So that's how you can't just make cortisol evil. You're right. it's not evil. It's only bad if it's in excess in our body and we
Mhm.
keep producing it and not burning it, not replacing it with good hormones. Like we got to keep a balance, a
Yes.
homeostasis of good levels of everything. Because high estrogen is not good, high testosterone is not good, high of anything is not okay.
No, and I feel like we all just want everything to be more. Give me
I
more.
know, I
Like,
know, I
I've
know.
seen estrogen levels like blood, which isn't my favorite, but urine, like through the roof, and
Oh my
somebody's
god,
exhibiting significant symptoms of like
yeah,
more of an estrogen dominance and for a myriad of different reasons, but they want more because they're saying they still have all these symptoms. I'm like, well,
no.
what is your body doing with everything we're shoving in there?
Exactly.
You know?
And more, yeah, I am very, very, very customized with how I tell people to do things. That's why you started off exactly the right way. When you eat it, when you move, when you sleep, okay, when you laugh and you have orgasms, when you do all these things, like
Yes.
just Mother Nature ways of coping through life as much as possible, then you kind of balance it yourself. Your body knows, it'll give you those signals, right? And you have to
Yeah.
listen to your body and do what's right, not just take the same dose every single day of, like, a pellet of estrogen. That's not okay. You know what I mean?
Yeah.
So to me, I'm with you on that. I believe in like auto regulation. Like we need to be the drivers. Like we're sitting in our own body and we need to say, you know what, today I really need to go for an extra walk because I just
Mhm.
don't feel that good. And I have a bad cramp. I've got whatever. If you have your period, you should go for a walk. People
Mhm.
always think, oh, I need to stay in bed. I need to take extra pills. No, those are the days you got to move more, you know?
Yes, absolutely. And I spent years of my life suffering with like horrendous cramps, but it
Yeah.
didn't even strike me as unusual because it doesn't everybody have really bad
I
cramps?
know. I know. We think that growing up because we don't want to talk about it. No one told us when we were, growing
No.
up, like, oh my God, this is not supposed to be this painful. Because everyone just gives, the doctors just give birth control for everybody. And they're like, oh, nope, you're not supposed to have a painful period. God forbid,
Yep.
So instead
Yes.
of saying, go for a walk or stop eating sugar and caffeine and salt, instead of telling us these simple things, they just make us feel like we're pariahs and we shouldn't talk about it.
Yes, and you're bringing me back to my women's health days. I sure prescribed a lot of hormones, but
Hmm.
the more I learned about the body and the deeper into
Yeah.
functional medicine I got, I started like it's e-scripts now, but putting on like a prescription pad cruciferous vegetables.
I know, right. Exactly. Exactly.
And I had patients and even people in the office saying, "Are you prescribing cruciferous vegetables?" I'm like,
Tara,
"Yes."
because nobody eats it. Nobody eats it. They don't even know what it means. They're like, oh my God, what do I do with
No.
a Brussels sprout? What do I do with it? And you're just like, oh. So you're absolutely right. It starts back to like basic eating 101.
What are some like tricks, like or tips, tricks, hacks, like whatever word you want to use? And
Yeah,
this wasn't one of my questions I was going to ask you, but I really want to know. Like because you said a lot of people don't even know what cruciferous vegetables are, and this
right.
is something I'm opinionated and passionate about a lot of things, but definitely about cruciferous vegetables for
Yes.
everybody, but in
Okay.
particular women with hormonal issues. So like what are
Yes.
some hacks if somebody's like, I
Oh
hate
my gosh.
cruciferous
Number
vegetables?
one, you don't have to eat all those vegetables if you don't want it, but DIM is a really excellent, like, it's a vitamin that pretty much takes all these cruciferous vegetables and gives you bowls and bowls and bowls of it, like 30 bowls of it if you take a good DIM. And I recommend only pharmaceutical grade. Okay. So what that means is you're taking this vitamin for men and women and for kids, teenagers, like with PCOS or any period issues, hormonal issues. It gives women higher levels of estrogen and men lower levels, and it gives us lower testosterone and them higher testosterone. So in general, what it does is it helps balance out our hormones. See, vegetables have a lot of anti-aging, and they prevent autoimmune disease because they alkaline the condition of the GI system, like the gut health is alkaline instead of creating more acid. So the higher our acid levels in our body, the more disease formation happens, more viruses, more bacteria. So eating cruciferous vegetables is probably the most powerful way
Mhm.
to get longer telomeres, get a healthier estrogen production. So that's one, taking DIM. But vitamin D is my favorite. Hands down, vitamin D. If you don't have enough vitamin D, you can't make enough of your own good hormones. So K2D3 is probably the safest thing for people right now because we don't know who's got high cholesterol and we can't test
Mhm.
them. We don't want to give medical advice just straight up to everybody, right? So,
Yes.
so I tell people vitamin D is just like foundation. And then dim. I also recommend a lot of good healthy fats like omega 3, omega 9. Like I
Mhm.
love my fats, like phospholipids, because that's what makes the gut membrane, the brain membrane. And if you don't fix that cell layer membrane with good fats, and people make the mistake of eating lots of lots of sugar, like lots of processed foods. So the first thing is cutting out, like if you're going to eat any of these vitamins, you better do it by first eating right and then taking vitamins, because taking vitamins is not going to treat anything if you eat poorly. So cutting out alcohol and sugar is such a huge thing. If you just do some of those, like don't eat the bad foods,
Mhm.
you'll make a huge improvement right off the bat, right, Tara?
Yes.
Mm-hmm.
Yes, and definitely there's so many clinical pearls in there, the things that you talked about, and checkbox for healthy fats that's
Yes.
missing like so much.
Yeah.
I will say when it comes to DIM, I've seen some people do well. I am
Mm-hmm.
like a huge like I'm a nerd anyway, but when
Yeah.
it comes to genetics, I do a lot of genetic testing, and I'm not
Yes. Right.
suggesting everybody should get that
Yeah.
done,
Like
but
methylating tests and stuff like that.
methylating, but
Mm-hmm.
I actually have a variant of the CYP1B1 where if I were to take them, it would not be beneficial to send more down a carcinogenic pathway potentially. And I
Uh-huh.
see that a lot. So like DIM is like one of those things where the more I geek out with genetics, I'm less likely to say try a supplement and more likely to try to find a way to sneak things in. Like, can we sneak in? Like, I've got this several people growing microgreens, and they're not gardeners,
Yes. Oh my God. Yes.
and
Yes.
throwing them in a
Yes.
smoothie. And
Yes.
literally, it's like a night and day difference. I'm
Sprouts.
thinking of one
Yes.
amazing woman in
Mm-hmm.
particular, and aversion to veggies was like the number. Like I said, this is probably one of the biggest mediators for your issues. Is this? And in a matter of just weeks, the
Wow.
difference in her body, and she still doesn't like vegetables, but she doesn't even know that they're in the smoothie, and she
That's true.
feels like
Yeah.
so much different. So, and again,
No,
I'm
you
not
know what?
against
Well,
I'm not against
I
supplements.
I need to tell you, you know what? I don't. That's a probably the last thing I do with people. I do lifestyle alterations as far as like how they're eating, how they're sleeping, all that. But to me, sometimes like you're right. Dim isn't that you do that after you check people's levels. You're absolutely right. But if I had to tell someone like what could you do
Yeah.
for PCOS, like I would say, you know what, it doesn't hurt to take it in. But you're right, eating like broccoli sprouts, eating those great sprouts and doing it in a smoothie is probably way easier, and it should go through the body's enteric system
Yes.
to heal. So I get what you're saying, and I agree with you. Totally agree.
Yeah. And then I'm like, look at all the other things you're getting, all those phytonutrients that you're getting, because
Yes.
somebody could just take a broccoli capsule, the
I
broccoli
know. I
extract.
know.
But I
Right.
mean, how much money does somebody want to spend? And I'm looking at it like you mentioned this in the very beginning. Like, what is the body going to do with it? Are
Right.
we able to process it
Break
and
it down.
utilize it?
Yep. Mm-hmm.
Yeah.
Yes. Well, it's hard. I think like I'm seeing that so many people have, like you probably doing autoimmune and specializing in autoimmune, realize the importance of gut integrity and
Mhm.
maintaining our microbiome. So you're right, like, putting something and eating something in our body, putting it in a pill form as opposed to eating Mother Nature whole foods. Oh, it's a world of difference. And you could sustain eating whole foods. You could sustain it, but you will get sick of taking that pill. And you will just, if you don't eat, you can't take that pill. You don't even digest it well or absorb it. And if you don't have good microbiome, you won't even absorb those nutrients from that pill. So there's a
Yes.
lot to be said for that.
Yes. And I love that you are a lifestyle first practitioner because I feel like, because that's definitely me. And sometimes I'm not usually running these like expensive tests in the
Mm-hmm.
beginning. There's so much we can do without them. But
Yes.
so many people, it's like if I give you a drug, it's going to have an impact on you faster. But
Yes.
if that's all you're looking for, I mean, really, I tell them they should see somebody else. I mean,
I,
somebody
I
that
agree.
in conventional medicine to get it covered by insurance.
I
Um,
know.
but you brought up vitamin D and K2 and kind of hinted at another one of my favorite topics, and actually a question that I have for you,
Uh-huh.
for maybe like a supplement to avoid. Like I'm thinking about in particular like calcium, and
I'm
you
not.
like
Yes.
alluded to it with the K2. I would love for
Yeah.
you to speak a little bit about, especially I have a lot of men that listen to the show, so this is for both, this is for
Right.
everybody. But
Mm-hmm.
since going off of piggybacking off of the womanopause, which I wish it was
Yeah.
called that, that'd be a better
Yeah. I
term.
know. Right.
Like, why
Mm-hmm.
is this so important?
Okay, so K2, we've realized that people are taking vitamin D, and even with especially with post COVID, we've seen so much because, of course, we're telling everyone, the naturopaths and wellness doctors and all of our caretakers of people are telling people take vitamin D, take NAC, all these things, but people take high levels and they don't exercise, they don't move, so you get accumulation of D, or not just D, but when you take high levels of calcium, especially, you need vitamin D to take it and integrate it into the bone and into the teeth, like all the places that vitamin D should be stored. It doesn't get there. So K2 helps mobilize it into the proper place. And the problem with a lot of people is they eat way too much processed foods and they can't take the, even if you get vitamin D or you're in the sun, you'll probably have low vitamin D but high calcium levels, because people for some reason have always been told to take calcium, 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 but no one says
Yes.
take D, 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 D. So they take all this calcium. It sits in the kidney, it sits in the breast, it sits in the heart, forms calcifications. We have heart disease, kidney stones, gallstones, etc., breast tissue that's calcified, and that's dangerous. So,
Yes.
if you don't have a good D to take the calcium into the bone or to the enamel or to the right places, we have side effects. So that is why it's just cautious and prudent, and especially with men. Men before, they would easily take in so much more calcium than women, just because they didn't even think about the food groups that they eat, probably. And we have periods, we probably don't take enough calcium in, and when we go through menopause, we're more prone to osteoporosis. So we're told by all these conventionalists to take extra calcium, but no one attaches D or magnesium to any of
Mm-mm.
those terms. So we need magnesium, we need vitamin D and K2 to lower cholesterol. Especially if they have high cholesterol, excuse me, to help mobilize the D into the heart tissue. So that has a lot to do with it. And we found in men, especially if they don't have vitamin D, and if they don't take K2D3 enough, they have an increased risk cancer of a risk of prostate cancer and heart disease.
Yeah, it's so important. And again, the conventional training is calcium, just take calcium, not even any discussion, like you said, about vitamin D and how important it is to take K2.
Yes.
And I feel it's so important, even if somebody doesn't have cholesterol issues or anything going on with their heart, or that they know of. But if they care about their heart, if they're taking supplements, which I feel like a lot of people that see me, they're taking vitamin D when they come to me, but it's not high quality either.
Right. Oh, you hit it on a nail. It's not high quality, and that's dangerous because it can be rancid. And we're
Mhm.
dealing with, I was trying to read, I always try to read a lot of the latest things put out. And one of the concerns was that they put out like toxicity, vitamin D toxicity. Well, if you took it with K2, you wouldn't ever have to worry about vitamin D toxicity because it goes into the bone. And it's very rare to have that unless you have a secondary condition like kidney issues, because vitamin D has to be converted in the kidney from D2 to D3 to be activated. So it's very, very rare. We see even with high dose vitamin D, K2, D3, that you'll see side effects if you take it with K2, D3.
Yeah, I'm trying to think if I've ever seen a high level of vitamin D. I see low levels, And
Oh,
interestingly, I've had practitioners around me, like when I was saying I was running, vitamin D levels on individuals in the winter, they're like, I wouldn't do that. It's going to be low. I'm like, that doesn't make any sense. So like
yeah.
part of the year we can have like significant deficiencies. And
Yes.
my level, and I know every lab is different, was like 17. It's no wonder I had so many problems,
Yes.
and
Yes.
if we're speaking about supplements, because I think this is a very hot topic, and I am again opinionated about a lot of things, and I take supplements, and but it matters. Like I tell people when they're asking me that the brand, the dose, the length of time somebody takes one, it matters, and that just picking something up at the local discount drugstore is usually not my recommendation. I have them.
Oh,
I
not
pull
ever.
it up, reading the labels. I'm like, look at all this garbage that's in here, and we don't know anything about
No.
this is made of. So how, like, if you were going to like mentor someone, counsel somebody, like how to like determine if supplements are legitimate and safe, how to buy them online, like what are your thoughts and strategies on that?
Okay, so I'm very biased because I'm in the research part about supplements, and I don't trust the FDA because Food and Drug Administration has the wrong food scale, has the wrong. They don't test vitamins. They don't regulate any supplementation or vitamins. So when you go to Walgreens, Costco,
Yes.
CVS, you're buying the lowest grade because nothing's regulated. They could put whatever they want. It could be false advertisement, and they basically have to just put a disclaimer: this is not FDA regulated or monitored. So basically, what's happening is that you just have to take what they take, and so there's fillers, there's gluten, there's dairy, and
Yes.
there's a lot of rancid oils. Vitamin D is very expensive for a reason. Some of the expensive vitamins like CoQ10 or turmeric, vitamin D, spermidine, all these expensive things like NAC, they are expensive for a reason because they're
Yes.
not easy to put together and sustain, and they have a limited shelf life, right?
Mhm.
So what happens is I always recommend to my patients get a nutraceutical grade, which means that it's been third party tested and it's
Mhm.
worth paying more when some less is more. When something's of good quality, you don't have to take it every day. You could take it every other day. You could take it alternate every third day. So the goal isn't to take a handful of supplements and not know the quality product. So this is your body. You could toxify your body
Mhm.
and do harm if you're taking poor quality supplements. So I tell people, get it through someone you know. Generally, like your patients, people you're helping, they should get your supplements because you've looked at them, you've vetted them. And that's very important. That's like someone going and getting expired milk and drinking it. You just don't
Ugh,
do that. Right. So people don't know the quality of their vitamin because it doesn't say on there, right? The same way that you can trust because the FDA is not looking. They're not regulating it by high standards. But when it is CGMP, which is something that they'll brag about, like a vitamin company, that means that it's of highest, purest quality, and what they say has been tested by third party, and you can't even return it, like because it is considered a drug that it's in a vitamin form, and it's that potent and that quality that you can't just take it and return it because we can't return drugs to CVS either, right? So
yes.
I would rather pay a high quality and premium price for one vitamin that you take than paying like for six vitamins of that same price and you're doing your body harm, like your liver, you're congesting your liver and you're putting in, something that's not been proven or tested. It's kind of scary to me.
I could not agree more.
And that's
And
why people don't feel better when
yeah,
they take these vitamins because they're poor quality.
yes.
You should feel great.
Oh
You
my
should know a
goodness.
difference. You should be like, oh my God, I took the D and I feel so much better. It's been 2 weeks. I know it's only 2 weeks, but I feel fabulous. So you're
Yes.
supposed to feel an impact. Like, just like if you drink a bottle of wine, you feel a difference, right? So you should feel a difference when you take something really good for you, like a vitamin, that is
You
supposed to
you
help you.
like you hit the nail on the head. Like
Yeah.
that's a phrase I've been said that like 16 times yesterday to people for some reason. It stuck in my head. That is so true. That so many people are on like buckets of supplements and they're like, I
Yeah.
don't feel any different. I don't feel any better. And I'm looking at it and I'm like, well, that's all garbage. Like what you're
Yeah.
taking. And like you said, it's clogging up the body. Like
Yeah.
we're shoving stuff in there and just hope it does something. And in my experience, it could be very dangerous and it could have the opposite effect. of what we're looking for. And it has to go through our whole biotransformation, amazing pathways in the body. The body has to do something with it. And what kind of chemicals are in there? And you brought up a arch enemy of mine, gluten.
Yes, yes. Isn't
That
that sad? It's a
it's
filler.
in
They
so
put it in
many
everything.
things.
Food, vitamins, shampoo, you name it, they put it in everything, you know?
Yeah.
So it's a filler. That's why it's a filler. It takes up space. So, you know, it's wrong, but quality matters. You know, quality, your body is a temple. You just can't put in stuff just because something says it, you should, you know? You have to really look at it, look at the micro of it and really read the fine print. And I think that's where practitioners, we make such a big difference because we could lead people to the right way. And if they feel improved, then you should be loyal to that brand, because branding is important. Like supplement
Mhm.
branding is important because people spend a lot of money wasting taking things that
Mhm.
they shouldn't. Less is more. Taking the right things really do matter, and taking you can take less of it over time because your body has adjusted and improved because of your good habits of sleeping and eating right. So it's not about taking a lot, it's about taking the right quality.
I love that. And I love, really getting into like the nuances of supplementation, because like you said, I probably, if I'm recommending something, I know the company, like I've
Yeah,
researched it.
you should research it,
Usually
and you
I'm
probably take it yourself.
taking it
Right,
myself.
right.
Yeah. And some people, they come to me and they're like, can you just give me a list of everything you take? I'm like, no. How do
Yeah,
we know you need it? Like, what else are you going to do? Like,
exactly. It's to be
if
customized.
yeah,
Yeah.
it needs to be customized. And if somebody's not willing to do anything else, I believe, and I've seen, and frankly I lived it before I really understood, I'm going to have to make some changes in my
Yeah.
life. I can't swap out like that initial road into functional medicine. I do feel like there's still a lot of functional medicine practitioners that are, have this mentality, and it kind of goes like against what I believe now, which is instead of a drug, a supplement. Like it's still a
Oh
pill
yeah.
for an ill.
Gotcha.
And
Yeah.
instead
Yeah.
of like, can we have a conversation, about that individual? And you said that, and I love this, that it needs to be personalized, and
Yeah.
not so that for the listener, I would imagine everybody knows what that word means. Not everybody gets the same thing. So
Exactly.
like the concept of a protocol, and I don't use that word very often because it's, in my opinion, it's so misleading and it's triggering for me, because then it's essentially saying everybody gets this, it's the same exact thing and we're all the same, versus like, especially with processes in the body, like what is it that you need? What does your body need versus what
Exactly.
does my body need?
That's a
Right?
really good point. I love that. Yes, yes. And I guess when we get trained, we get learn about protocols, but we're not a protocol. You know what I mean? And just like you went through your own, you had to fix your own issues and you had to use multifocal modalities,
Mhm.
So that's how, and what works for you doesn't always work for someone else who has lupus or who has fibromyalgia. So, it's so, that's why it's so important to really break down what somebody needs, and they might not need it all the time. It's just it's just something right now that's functionally important, but later the glass is full and we don't need that. We got to look at other things, so things change, our bodies change, and seasons change. That's why I tell people it's vitamin is not the answer, but there's a difference between you working out regularly, eating properly, sleeping regularly, and then just taking the same vitamin every day. You're gonna change the vitamin dosing. You're gonna change things. All your good behaviors add up, that you might not need this all the time. You might not need as many. And your GI
Yes.
system is much improved, and so is your immune system, and your mental brain fog. Your brain fog is improved. So that's what we have to like shift and change along with your body. That's why we can't just say, "Oh, take this and take these 50 things," because you're on a different regimen than they are, because their season is different.
Yeah. And you said like, and the dose might be different. Like we're doing
Mhm.
all of these things that adds up over time, and then
Yes.
we need less. And I feel like that's another thing that's so misunderstood. And that can even be the case with somebody's prescriptions. Like, well, I don't have a thyroid. If I did, it would be different. But for people that I'm managing, helping them with thyroid issues, are you currently suffering with Hashimoto's? Have you been told there is nothing you can do? Are you tired of the never ending fatigue? Are you ready to overcome the debilitating brain fog, anxiety, joint pain? I created a masterclass where we dive into the underlying root causes of Hashimoto's so we can get you on a different pathway. One that leads to not only improving your symptoms, but transforming your health. For now, I'm offering this masterclass for free because I know how it feels to keep searching for answers and coming up empty-handed. If you'd like to gain instant access to this masterclass, comment down below masterclass and I will send you the link. Now, back to today's episode. Or like Hashimoto's or whatever,
Oh, totally.
that
Yes.
if they still have a thyroid, a lot of times they can their dose can dramatically reduce, and maybe they can even come off of it when we like remove like the triggering alarm in the body and really work on nutrients. Because like you brought up like the soil, non-GMO, which yeah, absolutely, and the importance of making sure that we're getting the proper nutrients for the body. I mean,
Yeah.
it's so misappreciated, like not.
I know. People, I think like those are the discussions we need to have more and more. Like, what are you like? There's no accountability for our people. Like, even us, like, we have to be accountable because we are functional providers. So we should live this and own it so other people can learn to do that too. It's a process, you know?
Yes.
And so if it was so simple as just like you said, replacing one pill with another pill, one is a vitamin, one's a drug, it's not that simple. And so that's why this is a process, and people have to be accountable for their actions. And it's okay. Like sometimes you have different difficult years, and we get it. That's why we're here to work together as a team, But I really encourage my patients to really own their behaviors. Like this is
Yes.
you. Okay, this is what you're doing every day. So own it. Are you proud of it? And if you're not, change it. This is like a hard thing to tell people, and they don't like to be told that because they're like, well, poor me, I'm a victim, this is what happened to me. I'm like, well, it happens to, we're human beings, we're made by God as imperfect beings. We all have issues. There's nobody
Yes.
that doesn't have affected by some medical condition. Me, you, everybody. So I don't like the victim role. I like people to be like, okay, what do we need to do, what can we do? And so that's why we're here, right, to help
Yes.
people change their bad contributions so they can regenerate, not degenerate.
Yes. And like I tell individuals, nothing changes unless you do.
Yes, 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 yes.
And that's a tough, that's like you said, it can be hard for somebody to hear that because they're used to, where's my pen? They're used to coming into us practitioners and thinking like we have magic and we just
I
wave it and
know,
then
I
they're
know,
better.
I know.
And
I know, and
it
now
doesn't work like
now this
that.
is getting to be more fun it's more exciting, like this kind of field of medicine. People just come into it expecting so much. They have to expect a lot from themselves. You know what I mean? Like they have
Yes.
to make the right choices, and there's consequences for drinking alcohol. There's too much, especially regularly, consequences of sugar. So when we talk about hormones, especially, there's so much research that like our
Mhm.
country deals more with hormone imbalances because of our food, our nutrition, our lack of, I should say, where other countries, they don't have such difficulty with aging. And so there's a
Mhm.
reason. Like we are filled with GMOs, we are filled with poor
Yes.
quality foods, and they're too accessible for our children and for us. Like it's too convenient now. And Amazon makes it like delivered right to our house. So you don't even have to and all the delivery food systems. So people don't even move to go get food now. It just comes to you. So we have to rebuild this system, and
Mhm.
we need to talk about it so we can do it in our families and spread it out, everywhere, so more people are aware. But that's why what you're doing, like your podcast, is so important, because the more people that hear this, they apply it to their life, then they do it to their children's life, they do it to people they love, that affect people. So we have to keep growing this education.
Yeah, I agree. That's why I started. That's why I started this podcast. And when I think about, like, you brought up the food, obviously our food, and what the children are eating, and it isn't what my grandparents were eating, you know, like, or your grandparents. It's so different, and it doesn't even resemble the food anymore. And it's so convenient. And then, like you said, we don't even have to move. We can either have Amazon drop ship
I
something to us.
know.
We
So
can have
sad.
delivery. I can't think of, like,
Yeah.
Grubhub or whatever that, you know, they just drive it to your house. You can be sedentary. You could be sedentary. You could be sitting on the couch smoking and eating garbage.
Exactly, exactly. And you work out of your house and now you don't even have to. But there's a lot of healthy people who, when a lot of people love the transformation of being able to be working remote. That's great. But then they also go and work out remote, and they work out like in their own home. They eat in their home. But I think we can make it work. We just have to like do it in a healthier way, not like be complacent with our genetics and our genes, and complacent with how we eat, with our
Mhm.
role in life. And so, that really, that's what I find is the biggest challenge right now, is to influence people to own it and to be more aware of what they're doing and to change that.
That's really important. And you brought up the word complacency.
Mhm.
I think that I think that's very important for the listener to really grasp. I So many people come to me and they give me their list of diagnoses, all these monkeys on their back and things. And it's like, I have this. So then that means I need to take these things, and I couldn't exercise or do this because I have this
Right.
disease. And I'm sitting there, and they accept it,
Yeah.
accept it. So I think that that's so important as practitioners to work with individuals, educate people, and keep spreading the word that obviously it matters. The practitioner you see matters. It's important, but the patient individual is the captain of their ship.
Yes.
And to be
Yes.
empowered, that they there's something that they can do. Like, I call it an action plan. Like, I give everybody that works with me, it's like steps.
Mhm.
It isn't take these pills or whatever. It's like, this, we're going to work on the nervous system. We're going to work on breathing. We're going to, and I know how it sounds. And sometimes I see the look and they're like, what does that have to do with PCOS? I'm like,
Right.
has everything to do with PCOS, right? That we can't get
Yes.
away from the foundations of health, right?
Agreed. Yes,
And,
agreed. Totally. I mean,
and go
health
ahead.
is earned. It's earned. We earn our health, and whether it's with bad habits or good habits. So,
Yes.
so the fundamentals absolutely matter. You know,
Yes.
if you don't start there with the basics, then you can't build on something solid. So I tell, a lot of people when they go on vacation, they go on holidays, they come back, they're like all nervous to do their blood work or their urine test, and I'm like, why do you feel bad? You've been 90% of the time you're good, 85% of the time you're good. You don't need to feel bad if you ate a little bit extra of this or didn't move as much, or it's okay. Our bodies know how to survive. Our bodies are amazing. It's just that we
Yes.
have to do most of the good habits most of the time instead of doing bad habits most of the time. So these are like our body, it wants to like regenerate. It works with us. It doesn't work against us. When you put too many fake drugs in or prescriptions in or plastics in, that's when, we call it xenoestrogens, which is like plastics from, plastics from estrogens from plastics, which cause cancer in everybody. But when you put like fake things in like that, that's when we realize that, you have to do a revamp of like nutrition, because you can get rid of those like things like mold and plastics and things. It's just it takes time, but there's no quick fix. Just like there's no quick way you got here.
Now you sound like my husband.
Yeah.
He says that like all the time. Like, it takes so long for us to become diseased, right?
Yes.
And then, but when we have it and we are looking to somebody like, hey, I want to feel better, put me on an optimal pathway, there's no patience. It's like,
Right.
get me
Oh my
there
God.
as quick as
What's taking
possible.
so long? Exactly. Why am I not sleeping yet? Yeah,
Yeah,
exactly.
and I want to put somebody on like the super highway, but
We would love to, but it's not, we're
no,
not
I tell
Amazon. We're
people
not.
no, no, and actually, right in the beginning, if I on a discovery call with everybody, I tell them this is not going to be easy. It's functional medicine is not fast, and it's typically not easy or fun
Right,
necessarily. Not that it
right.
takes forever or is difficult or is terrible, right? But it's a different mentality. Like I feel like people have heard maybe or maybe not the term functional medicine, but we look at it as, or at least I feel like society, where we're doing something more natural or root cause, trying to figure it out, but using buckets of supplements in the process. And so, like, that same allopathic mindset of give me something, do it for me, like write the script, give me this to make me feel better, versus, okay, now comes the work. And
Yes, yeah.
I ask people, where do they want to start?
Hmm.
Because there's so many variables, like you brought up, walking, and obviously the things that we put into our body, our thoughts, like all of
Yes.
these things
Oh yeah,
matter.
absolutely. I love that. Yeah, it's how you think is a whole nother, like the mental health right now. Oh, we have so much to clean up with everybody. It's so hard, and I do, I don't coddle too many patients because, we're all in this together. We can get through it. I think that's probably like my biggest thing I have to say that makes me sad about functional medicine is sometimes that, I grew up in a genre, of just being an immigrant too, of like loving America because it's a place where you work hard and you get rewarded. That hasn't that we shouldn't fundamentally change that with anything. People have to still remember they gotta work, whether it's for
Yeah.
your health. Okay, no, but it just seems like now we don't have to. Like, can't we just give me something? Can't we just like I'm like, no, because then you're not happy. That's why you're not authentically happy because you're not working for it. So when you really work for your health, you're gonna see the benefits and you're gonna feel so like calm and rewarded, like internally content. And that we can't give to someone in a pill. We can't give it in a
No.
vitamin. So it's about working. We can guide them, we can teach them what we know, we can help them figure it out, but they got to do the work. And that's why, like, it still is a challenge for us, just like conventional physicians, right? Conventional nurses, conventional caretakers. It's still going to be a challenge even for us because, people got to step it up. Everyone does.
Very well said. Absolutely. And let's just say, like, if somebody's feeling overwhelmed, if the listener's like, oh my goodness, I have to do all of this work, and my doctor or my practitioner,
Right,
they're not even listening or anything
right.
like that. This is definitely not, and I thought functional medicine was good, and now I
Yeah.
can't, well, who do I trust? Do you have any like recommendations, like for like the individual listening, about finding the right practitioner? Like, how does somebody, how would you recommend, like, if it was a family member of yours or a friend, like a strategy for finding the right practitioner, and maybe even like what red flags should they look for?
Okay, love that question because number one, I tell people find someone that listens and that's hearing what you're saying. When someone comes in, sometimes as clinicians we want to fix what we think is wrong based on clinical blood work or what we see. No, are we hearing and listening what they're saying? So they need to be heard, and they need to feel a sense of trust and a sense that someone cares. If you don't feel like someone in front of you cares and you're paying them money, get out. So I tell people you have to feel like someone's there with you and they care, they're listening. And it's so important that the trust factor is there. Like, we should say we don't know. We should say, you know what, that's going to be tough. Maybe in a few years your estrogen and progesterone and cortisol and testosterone will be more balanced, but it's not going to happen in a few months because it's just so it's that to honesty, and that's so important. So you can get that through nonverbal communication. I think people pick it up through, like, they have instincts. That's your gut feeling, and you should listen to that. And that's going to create a partnership that's very rewarding for both people. Because we love to see our people we work with like do well. We're so happy that they're transformed and they have more energy. Even if it's just one little thing at a time, it
Mhm.
matters. So to me, the red flags though on the other end would be someone who doesn't get affected by your pain. Like they don't have to
Mhm.
cry with you, they don't have to cry, but they should really understand that this is a significant impact, and they should have that empathy and compassion. So if they don't and they're more mechanical, I understand, yeah, we have to think of like some process for them to heal and help them figure that out. And it does require a lot of like brain work, not just
Mhm.
heart work. It is a lot of brain work that we do, so based on science and based on like everything we've been trained on. So to me, if a doctor's not like a nurse, a naturopath, if you don't find that they care and they're not engaged with you in any way, yeah, that's a red flag too. And to me, I tell people, you get what you pay for. There's a reason why we don't accept insurance, because we don't work for the insurance company. We work for you, right? This is us. We survive and do well when you do well. So it's a win-win. So to me, I encourage people to have a team of practitioners. That you have a masseuse, have a chiropractor, have a nurse, have a naturopath, have a acupuncture. You work with multiple people. It's not one person is not the answer. It is not one doctor in your life or one caretaker in your life or care provider is not going to make everything happen for you. You have to have a team. So be open-minded to that. So if it's a trainer, that should be part of your team. Like someone you work out with, someone that you go get acupuncture with. Different things matter. It's not like you can put all that pressure on this one appointment that you have with this, you know, functional medicine provider. It's just not fair because it's not how it works.
That's like so amazing that you talked about that. And I always say, like, I'm like, we're not an island, and
Yeah,
the more the merrier. And even
yes.
things like yes, massage, love it. And other people like lymphatic massage,
Yeah,
personal
like
trainer,
cupping, whatever you want to do, like, energy
acupuncture.
healing, energy
Yeah,
healing, whatever
we're
you
not,
want to do.
there's no competition between
No,
all of this, because it should
no.
be. And absolutely, as a red flag would be somebody that is like, I can do everything. Like,
Yeah,
I don't know if anybody would
yeah.
actually say that,
I
but
know. Yeah, exactly. That's another red flag. You wanna go there and you wanna feel like, authentic care, authentic like involvement. And that to me is that speaks volumes.
yes, could not agree more. This has been, Dr. Rocco, such a wonderful conversation.
Oh
Is there
God, I know.
anything we haven't covered that you feel the listener would really benefit from knowing?
Yes, I'll just tell you, you already know this, but I feel like, people think that life is so expensive. People complain about money. And you know what I tell people? And I know this is common sense already, but we have to remind ourselves that the best things in life are free. I know it's expensive to buy a good supplement or make an appointment with a good provider, but in all fairness, if you laugh more, if you go watch a comedy, that's how you get over a difficult day. If you go for a walk, okay, and you have gratitude journaling and you just write three things down that you're grateful every day. If you don't have to get the most expensive food, but Trader Joe's is pretty reasonable. Okay, it's a reasonable place that doesn't have GMOs, and you can find a place like that by you, or go to a farmer's market. And doing these little things every day add up. They add up, and they bank your health, and these little things add up. So I tell people, start small and keep doing things for yourself, even if you don't do it with a provider. Like, better, do a little bit every day and be proud of yourself for it. Stop looking at things you're not doing and things that are have mental health is so important, and we're not talking about it enough. So if you think positive, if you look at what you have and what you don't, and if you look at how Mother Nature regenerates, even through the worst things like fires and hurricanes, well, so do our bodies. Okay, that's us too. We're created by the same creator. So you have to like stay in the positive and look at those things. And these are all free things, like how we think, how we sleep, having orgasms, having laughing jokes, like just being kind. These are all things that matter more than anything than a pill.
Yeah, we are definitely like aligned.
I
There's
know,
no doubt about it.
I know
Like,
we are. I know.
I
I feel
felt,
like we're like you're just reading me, and you're just like saying the same things. Yeah, because
yeah, and I feel like the
same.
listener is,
Yeah,
if those listening or watching, if you haven't written down or with a pen and paper and following along with this conversation, go back and re-listen and make notes, because like I always say, it's the bottom of the matrix. It's the modifiable lifestyle factors that are the most important. And
yeah,
again, for anybody, for I'll be a broken record, these are the things I did last. So I didn't get better for the longest time because I wanted a quick fix. So that's why I'm so passionate about talking about this, because I could not believe the now I can believe it, but at the time, the difference that the simple things, like
that's
you
so
were
true.
saying, the
Yeah,
free things, the laughing, the gratitude, the moving our body, it sounds so simple because it is, that
yeah.
these are the things.
Yeah, people
Yeah,
overlook these things because they're like, "Oh, it's too simple." Well, keep it simple, stupid. That's the way. That's the acronym KISS. And I think like I've learned the hard way too, because just because we learn so much, we think that we have to present this big topic. This is it. But yeah, when we start simple and we see the cultures demonstrating it in all the blue zones, old school centuries like of the same patterns, it just reminds us, yeah, let's keep it simple, let's just do what's really working, and let's start there and add to it slowly.
I do. And I have absolutely loved this conversation. How can the listener learn more about you? Like how do they find you?
I do have my own practice out in California. I'm in Southern California, and I have a book I wrote, Growing Younger, because I know we can't see everyone and impact everyone. I'm not big on social media, only because I just have 3 kids and I just am private and I'm too shy to like do enough posting, but I'll get there eventually. So I think that people can find me. Probably I do a lot of fun interviews, and I write quite a bit. So you know, I just probably on your podcast and other podcasts, I do fun things, but this is my biggest passion is that probably, right now being mom, enjoying motherhood. I do love being a mom. So medicine is important to me. Like all my patients are significant, but I want to contribute to my own kids first, and really enjoy this phase while I still have them. And then maybe I'll grow in that department more later.
Well, I got goosebumps, because
Oh,
that really like it that really like matters, and I love how like genuine, like real you are, that
thank you.
for like your kids. And yes, I we're sometimes we can get so lost in like the day to day and our careers, and not take the time for what's like the most important.
Right, like
And
our family, self care.
yes, yes, like my kids are grown. I've got grandchildren, which
Oh
is
wow!
awesome,
Oh my God, you
which
look
is amazing.
amazing.
My
Okay, by
youngest.
the way, Tara, you look amazing, and you look super young. You practice what you preach. Yeah.
Well, thank you. I'll be 50 this year, so
Oh
I'm proud of it. But
yeah.
my youngest is 25, my youngest son.
Oh
So I don't. I don't really have a lot of time because I'm doing so many things. But
right.
my focus is more on spreading the word, and like autoimmune things, and
Yes.
all the
Yes.
podcasts and things like that. But I have to remember self care, and I love that you brought that up,
Mhm.
because that is something I see missing in most individuals. And I tell everybody that I work with to look in the mirror and tell yourself, I am the most important person in my life. And that could be hard to say to a mom of young kids,
Yeah. Yeah.
because obviously you're not going to disregard your children. But if we don't take care of ourselves, how can we possibly be there for anybody else?
Yep. Agreed. Totally with you on that. Yep. We
Well,
speak
thank
the
you
same
so much.
language.
Thank you so much for
Oh,
coming
my
on, and we'll have
pleasure.
to
My
have you back
pleasure.
on someday.
Oh, thank you so much. I loved hanging out with you. This is such a fun conversation. Thank you, Tara, for having me. It was a pleasure.